right. Welcome to a deeply meaningful episode of Therapy in Real Life. I'm your host, Sherrae. This month, we're honoring pregnancy and infant loss awareness. So, in today's conversation, we're going to be shedding light on a topic that touches way too many lives, mine personally, as well as our guests. Joining me is Arielle Jordan, who brings not only her expertise, but also her personal story and personal journey of resilience and healing. Together, we're going to navigate the topic and the path of grief. We're going to share some coping strategies and emphasize the importance of therapy in these deeply emotional experiences. I want to personally dedicate this episode to anyone that is out there listening who has personally, directly or indirectly, been touched by loss of an infant and or pregnancy. Those who know, unfortunately, it's a club that none of us would ever want to be a part of. So we want to take time to honor those who we've lost and those of us who have lost. We want to take time to hold space for both. So without further ado, I want to introduce properly our guest. I'm just going to read her vast list of accomplishments, and then I'm going to introduce her so that she can properly introduce herself. But Arielle Jordan is a licensed clinical professional counselor with over 8 years of experience. She's the owner of Mindset Quality, a telehealth practice, private practice, and she specializes in MDR, PTSD, grief, and trauma. With a background as an Army veteran and a PhD candidate in counselor education, Arielle brings a unique perspective to mental health counseling, emphasizing both cultural diversity and advocacy. Her extensive training in trauma-focused therapies, especially with EMDR, have allowed her to provide evidence-based treatment for her clients. Arielle is also a sought-after speaker and author known for her book Holding Space and a workbook that accompanies it that empowers readers in navigating grief and cultivating emotional wellness. She's also been featured in many notable publications, including Essence and Parade, inspiring personal growth and hope within individuals. Arielle is committed to providing a safe and judgment-free environment for her clients, believing that everyone deserves access to quality mental health care. Welcome, Arielle.
Thank you. What a
I'm
nice.
gonna, so I did the formal intro, but
Mhm.
I want you to do the more genuine, this is
Yeah.
who I am.
Yeah. I mean, of course, that covers a lot of the accolades, right? But yeah, I'm also a bereaved mother, and that is a huge part of me and why I do what I do. As for the rest of the things, wow, you noted a lot of them. But yes, I do love talking about this topic. I didn't always love talking about this topic, but I do now. And I've realized every time I do something like this that there is someone that says, wow, I remember, my initial stages of grief, or they are in the initial stages of grief. And whatever I said, as we genuinely talk about things or coping skills or whatever the case may be, they're like, oh, well, that was really helpful. So I love to talk about these kind of things. And I'm glad that you have me here as your guest today.
Absolutely. And I thank you for being here. I think the thing that you said right before, like, yeah, those are the accolades, and that's part of it. That, you said a great deal of it. And also, as a bereaved mother, that's part of my identity. Like, that's also part of what has shaped me and brought me to this space. And so, we're just going to have the conversation and dive right in. I want to
Yeah.
start though with you because we both have our own individual stories of loss, and they're both different,
Right.
right? They're around loss, but they're both very different. So I want you to share a little bit about your
Mhm.
story, where you were when everything occurred, and then where you are now, and kind of what that process has been like in your healing journey. Because as we know, it's a journey that kind of always continues. So what has that experience been like for you?
Phew. All right. Let's jump in. No, so my loss occurred in 2014, and my daughter was 18 months old. Her name is Jordan. I love to say her name because I think that's very important when we talk about like remembering and honoring loss. So,
Yes.
Jordan was born with a congenital heart disease called pulmonary vein stenosis. So she actually was a preemie. I had an emergency C-section with her. So I'm thinking that she's just a preemie. We'll get through this. She was in the NICU for about a month. And she just had preemie issues, like learning how to eat, growing, breathing on her own, and things like that. And when I took her home, I think she was like 3 months, and she had like this kind of like cold like thing going on. And the doctor kept saying, like, oh, you're a new mom, no big deal. And I'm like, no, she's kind of like projectile vomiting her
Yeah.
breast milk. You can't really create breast milk all over again. It
Yeah.
takes time for that. So, that indicated that there was an issue. And so I ended up taking her to another hospital. They said, oh, she's probably just got like a flu going on. We'll give her a little bit of oxygen. And they had a really hard time getting her vein. And what happened was she never came off oxygen. I ended up going home with the oxygen and having to navigate that. And what we learned was that her pulmonary veins were closing. And
Mm.
not only were they small, but they were closing. So that created a lot of pulmonary hypertension as well.
Mm-hmm.
So I didn't really get in a lot of options. They were like, well, we could set up palliative care. I was like, well, wait,
Mm.
they didn't do anything. Like, I
Yeah.
don't want to do that. So I Googled pulmonary vein stenosis, and Boston Children's Hospital came up. And
Okay.
I was in Virginia at that time. So I was like, all right, I don't care what we do, but we got to get to Boston.
Yeah.
And I called, and they had a trial study. And I said, I'm not sure how we're going to get there, but we're going to get there. And we did. I called the newspaper.
Yeah.
I got them to publish a story about her.
Yeah.
We got donations. We did like the flea market. We was
Yeah.
just doing all kind of stuff. We got her. The lady, so the doctors didn't even tell me about Boston. I found that myself. And then
Yeah.
I asked to forward her records there. We got there, and immediately they were like, we need to do a heart cath to see what's going on. And she lost one of her veins. So we have four, and she
Mm.
lost one. So one part of her lung wasn't getting blood anymore.
Mm.
So immediately, initially, there's a problem.
Yeah.
But she had this thing where she would like do well, and then there would be another issue. So I think essentially the longest she went without a heart cath was like 9 weeks.
Mm.
And so that was like 9 weeks of normalcy, nine
Yeah.
weeks being out of the hospital, doing what we wanted to do as parents. And
Yeah.
um, yeah, so we then ended up back in the hospital for so many different things. My girl ended up having a stroke at one point,
Mm. Mm-hmm.
and it was just a lot going on through her life.
Yeah.
And at the end of her life, which I did not know was the end of her life, she had gotten a port in her chest. So
Mm.
we didn't have to keep trying to find a vein and everything.
Yeah.
So actually, that port was a blessing because I could just numb it up and
Yeah.
play with some toys over here. And they would access that port, and she wouldn't even know the needle was in her chest. Like,
Yeah.
she was a rock star.
Yeah.
So when I lost her, it was a pulmonary hypertension episode,
Okay.
and it was very sudden. They tried to, do CPR to help her, and it just didn't work.
Yeah.
And it was even more devastating because it had happened before where they had to do CPR, and she came back. It was all right. So this time she didn't. And I just remember, the initial shock. And I
Mm-hmm.
didn't, like, normally when something happens, they kind of like push you out the room,
Yeah.
and you have to let them work on her, and then you can come back. But I thank God that they didn't push me out of the
Yeah.
room. I was in the corner away letting them work, but I think I would have had like some sort of blame or something if
Yeah.
they would have put me out. But I didn't. I watched everything. I know that they did everything that they could do for her. So
Yeah.
I felt like, no, it doesn't feel good, but at the same time, I was like, okay, I know in my heart that they did everything they could. And then
Yeah.
once that was over, they said, do you want to hold her? So I
Yeah.
did.
Yeah.
And the hardest part, I would say, is that they said you can stay as long as you would like. And in my head, I was never going to leave
Yeah.
because it's like that moment of insanity. Like, you're not thinking, you're just, and I
Yeah.
held her for hours. It was like 4 p.m. when she passed, and I
Mm-hmm.
didn't leave till after midnight. And I had the nurse that he had just come on, and he was so gentle with me.
Mm-hmm.
He took really good care of me. He said, hey, mom, let me have her for a minute.
Yeah.
Go take a break, use the bathroom. You can come right back.
Hmm.
Nothing's gonna happen. I'm just gonna clean her face up, and because she had a breathing tube and everything, and they were trying to
Yeah.
save her. And he, oh my gosh, just thinking about it just warms my heart because he
Yeah.
was so good to me. And I never met this man before, but he made sure we were good. We did like a memory box, her hand and everything. And that it just was what it was, you
Yeah.
know. And so from that point, that was like devastation.
Yeah.
And I remember like there being months of time that I don't really remember what I
Yeah.
was doing. And that was really difficult.
Yeah.
So it was like survival mode that we get
Yeah.
in.
Yeah.
We need to keep putting one foot. I didn't go home for like a month, stayed with
Hmm.
my mom. But I knew at one point I had to go. And when I went home, everything was how I left it, which is what I was fearing and dreading.
Yeah.
Everything was how I left it. And I was like, fall apart again,
Yeah.
right at the door. And so the months went by. I did try to work and keep moving forward, but it just was hard.
Yeah.
And I tried to like have a drink of alcohol, to try to like numb, but that didn't work. It worked temporarily, right?
Yeah.
But
Yeah.
so I was like, well, actually, that makes me feel worse. So that's not the route to take. So
Yeah.
that wasn't it. And then after that, it took about 8 months, I would say, of
Hmm.
just being in that fog
Yeah.
that there was a moment. And that moment was looking in the mirror and just thinking to myself, like, girl, you are too smart to just waste away. Like, this
Yeah.
can't be the end of you.
Yeah.
And that was before my birthday that
Hmm.
year. And
When did this happen?
this was the same year, 2014, because she
Okay.
died January 29th, 2014.
Got it.
So, I forgot to mention that after I was taking care of my dad and I lost my dad in April. So,
Oh,
like
wow.
Jordan and then my dad a few months later. So that
Yeah.
added to everything because I
Yeah.
had to take care of him because he had lung cancer.
Yeah.
So that was like taking away some of the pain because I could take him to doctor's appointments, make sure he's
Yeah.
okay. But then, boom, he was gone.
Yeah.
And he didn't tell me he was in stage 4 because I had just lost my daughter.
Yeah.
So it was hard. It was so much loss
It's a
at
lot
once.
of compounded grief and
Yes,
loss. Yeah.
yes. And those are two of my favorite people.
Yeah.
So after that, I was like, look, I don't know how I'm going to get through this. So
Yeah.
what do I do?
Yeah.
And at that moment, October came. That's when my birthday, the 29th of October.
Yeah.
So it was right before that, though. I was like, I can't continue to just do this. Like,
Yeah.
there has to be more.
Can I
Yeah.
ask you, Arielle, people who I've talked to, and people have even asked me this, but in the midst of you going through what I could only imagine is the worst thing imaginable that anybody could fathom would happen, that they would have to walk through or experience, in the
Right.
midst of you going through that, what was it like in those 8 months before, like, your birthday came and you got kind of shook you, like, come on now, you got to do this? What
Mm-hmm.
was your day in and day out? Like, did you have support? Who was there for you? What was it like to walk that difficult road, that part of the difficult journey? Because it has
Yeah.
ebbs and flows, obviously, it never stops. But in
Right.
that season of your life, what was it like for you and who supported you?
So I remember trying to go to therapy and I went to the VA and it wasn't it. I just felt like she just didn't get it. She told me about one of her losses of her husband. I think trying to connect, but it didn't feel good. But I did
No.
try because I was like, let me do something.
Yeah.
And then my mom was supportive. Like she let me stay there, but I also felt like she was in her own grief too.
Yeah.
So that bothered me because I was like, well, dang, it was my daughter.
Yeah.
But of course, it was her granddaughter. Of course, she's going to grieve. But in
It's
that
her
moment,
granddaughter, and
yeah,
her daughter, her baby, is grieving the loss of her baby, and it's probably over identifying, and she can't make it better. So I could only imagine. Yeah.
right. And like now that I'm, further away from it, I get
Yeah.
it. But
But in
then,
the moment,
yes, it
yeah.
was bothering me so much. And
Yeah.
so I feel like I isolated a lot.
Yeah.
My brother ended up having to stay with me for a little bit, and that was helpful. I will say that I don't even know if he knows it, but during that time, he was like such a big support. And it's crazy because we were both miserable.
Yeah.
So, like, misery does love company, okay?
So it's
Because,
good to commiserate a little bit with somebody that was in the same space as you. Yeah.
yeah, so it would be like, you eat? No, I didn't eat. all right, come on, let's go get something to eat. Like,
Yeah.
so it ended up like pulling us both up, going through what we were going through. And so like during that time, I will say like that's probably one of the things. And then I did know a mom that was having a baby that didn't have anything for her baby.
Mm.
So I asked, did she want Jordan's clothes? And she was like, are you sure? Soon.
Yeah.
And I said, you know what? I'm sure because I'm not doing nothing but going to her room and crying.
Yeah.
So if you don't have nothing, like I would love for these clothes to go somewhere where they're gonna be worn. So that helped
Yeah.
to get rid of some stuff. But yeah, I mean the basic needs went out the window at first.
Yeah.
It wasn't like showering. It was
Hmm.
really hard to go take a shower. Some days I didn't leave the bed, and it just like, all right, yes, eventually you gotta like sick of yourself almost. And so I'm like, all right, we gotta do something different. So I kept thinking it over and over again, like this
Yeah.
can't be life. But
Yeah.
I will say, like, my family's always been supportive, but I just don't know if I saw it or if we wanted it during that time period.
Hmm.
Because at that point, my daughter's gone. Also, right before my daughter died, a week and a half before my had left. And
Mm.
so no one knew that we were like headed towards divorce in that time
Got
period.
it. So
And
you
then,
guys were separated already when it happened, and then for some couples, that really just puts the final cut in things. How did
yes,
that end for you guys?
yeah, we got divorced the next year. It was a lot of stuff. Oh my gosh.
Yeah.
Well, we were both 21 when we got married.
Yeah.
So, of course, that's young to get married.
Yeah.
And it was hard. Then we got married. We talked about getting married and then found out I was pregnant. And
Got it.
then Jordan was early. She
Hmm.
came 9 days after our wedding.
Hmm.
So we got married and then here's baby. And not only,
Yeah.
but here's baby prematurely. Here's an emergency C-section. I had
Mm.
preeclampsia. So my
Yeah.
blood pressure was over 200 and
Got.
they were like, you're in critical condition.
Yeah.
So they had to move my baby to another hospital because there was no NICU there.
Mm.
So I'm hysterical. I'm crying. It's not
Yeah.
helping your blood pressure when you're upset like that. But I only got to see her once before they moved her. Like I didn't even
Hmm.
really know what she looked like. And
Yeah.
they took a picture for me, but that's not the same. I can't go
Yeah.
by the nursery and see my baby in there.
Yeah.
So, and it was for 4 days before I could see her. And I would like pump the breast milk
Yeah.
and all I felt like I could do for her and call the hospital like every couple
Yeah.
hours when I wasn't resting.
Yeah.
I almost lost my life giving birth to her. And
Yeah.
then,
Which is super common, unfortunately, especially with Black maternal health. It's common where we have higher rates or incidents of near death
right.
experiences and or losing our lives.
Mm-hmm.
When you're talking about it, I'm just imagining it just
Mm-hmm.
feels like if you're surfing a wave and you get down and then you get back up on the board and you go down again and you get back up. It sounds
Mm-hmm.
like from the beginning to the end,
Yes.
being with dad and deciding to have the baby and then the preeclampsia, which is a whole different story.
Right.
I didn't have it, but my friends who've had it, it's been a
Mm-hmm.
nightmare and terrifying because it ends
Yes.
up being a lot of times emergency C-sections that they end up having to have.
Right.
But from that to then 18 months later, be in the space that you were in,
Mm-hmm.
where, like, what do you grab hold of? Like, you said your brother was a support, but my thought is when it's this type of gut wrenching thing, there has to be something even deeper than an individual that we grab hold to. What for you
Right.
is that thing that causes that pivot where you're like, we all hit a pivotal moment where it's just like something shifts in us and we don't know what it is. It feels supernatural. What was that for you?
Yeah. And I mean, so like I've always believed in God,
Hmm.
and as a kid, you're like forced to go to church and stuff like that.
Yeah.
Well, in my family, I was. I think that helped. Though I will say for
Hmm.
myself, at least, like, there
Hmm.
was some sort of foundation there. And so I was like, it was I say I give God that because what else could it have been?
Hmm.
Like we're so low in that moment, like to even have or to even say, girl, get it together to myself,
Yeah.
I had to know that there's something else out there.
Yeah.
And so I'm about it. So there has
Yeah.
to be that curiosity.
Yeah.
And I think that's really what it was. It's like, God, I know you didn't put me here
Yeah.
for this. Like it
Yeah.
can't be that. I
Yep.
used to believe that.
Hmm.
So I think that's what it was. And I was, then the wheel started turning. It allowed for more positive information to like, all
Yeah.
right, so if I don't believe that this is all I'm here for, then what else is there?
Yeah.
And then I started to create from there.
Kind of like those existential questions we ask ourselves. How old were you when this occurred? I know you said 2014. What around were you in your 20s, your 30s?
So let's see, 2014, I was 21, 22, 23 years old.
Yeah, I was asking because I feel like you said 20s is like really young to get married, right? Well, my
Yeah.
first marriage was in my 20s. I was 22. It did not end well at all. I talk about that on a throwback episode that the guests will see at some point, but it didn't end well. I'll just say that.
Mhm.
But in that space, I had a real big awakening around that time. I always say, I remember talking to a therapist and I was like, I had a nervous breakdown. And she was like, well,
Mhm.
was it a breakdown or a breakthrough? And I was like, I'm okay being broken down. It was a breakdown because I believe in somebody higher than I. I was broken down. I was going to remain broken. Right. And
Mhm.
so in that space, it was like, it's funny because yours was 2014. And so
Mhm.
what's so interesting is mine was 2004, August 26th. Mobile
Mhm.
crisis had to get called. I remember the dates and I remember the times. And
Mhm.
so by the time I get to my lost journey, I had made all these deals and bargains with God. And the reason why I asked, was there something else you clung on, like that you were able to cling on to? It's because I always tell people, I remember I used to have what is it called? It was a Bible teacher. He was a theologian, though. He was pretty well studied. And I
Mhm.
remember, he used to say, well, if people don't believe in God, he was like, because we would be like, well, what if God doesn't exist?
Mhm.
And he'd be like, but what if he does? And I was
Yeah.
like, well, that's true, but what if he doesn't? And then we're doing, and he was like, well, would you act different if you knew that God didn't exist? Like, what would change? Is it like that you're doing that's wrong that you would do more of or less of? Like, what's the issue?
Good
And
question.
so, right, it was a really good question. And I remember thinking to myself, like, I believe, but I always had questions about religion, God. I just have never been a person who just believe. Like I was like, y'all tell us whatever just because you want to scare us. And
Right.
I'm from the generation that they still used to like put us in these rooms when we were like it would be like youth night and they put us in these rooms to show us the original behind movie from the 70s and
Mhm.
people were like, you've been left behind. Like it was like scare tactics. And so I was just like, I don't
Right.
believe in this.
Yeah.
There was a lot of,
Like the wage of
yeah,
sin is
oh
and
my
stuff like
gosh.
that. Yeah.
There was a lot of negativity. There was a lot of forcefulness, a lot of judgment, a lot of shaming, a lot of homophobia, racism. Because I went to a private Christian school that was very private, very Christian, very white, very
Mhm.
racist.
Okay.
And so I just grew up with a lot of like, I believe because I
Mhm.
believed that God showed me what I was going to do at 15. So I believed in God. I didn't know if I believed in religion per se, but I knew there
Right.
was something bigger than me, right? And
Yes.
then I get into a car accident in fall of 98. Shouldn't be here today because the car flipped multiple times.
Wow.
And I do have moderate arthritis in my back that they believe has been due to the trauma from that accident back then. But other
Mhm.
than that, no broken bones or anything. And I'm here today, right? I walk just
Wow.
fine. And then fast forward to the breakdown in 2004, and I survived that. And then in
Mhm.
2009, we almost lost my mom. She had a
Mhm.
cerebric hemorrhage, stage 4 brain bleed. And
Wow.
a lot of people, when they have those kind of strokes, don't make it. And
Right.
she's still here today. And so I think for me, I felt like God and I had this working thing. Like, I don't really, always subscribe to religious practices. I have a lot of questions, but I know
Mhm.
God is real in my life. So I'm like,
Right.
here's the thing about getting pregnant and having a baby. I always wanted to be a mother. Like when other girls are thinking about getting married and their husbands, I didn't really care necessarily about a husband. I just knew like it was a sin to have a kid without. So I was like, oh, okay, yeah, I'll get the husband. But I really wanted kids. I
Yeah.
wanted to be a mom. Even before a career, I wanted to be a mom. And so when it
Mhm.
wasn't happening in my first marriage, it was because I was preventing it because we were in a very toxic space. We were too young to get married. He had his own issues, and a lot of it involved substances with him as well.
Mhm.
So I prevented it. That was the one smart thing I did in that period in my life, right? And then I remember getting with my husband 14 years ago and thinking, okay, yeah, we can have some kids. We have kids. They're not my biological kids. They're my bonus kids, but I didn't raise them. And
Mm,
so it was like, okay, well, we're going to have our kids.
yeah.
I was on board. My husband was like, can we just chill for a minute? And I was like, okay, fine. And then he let me relax too long. And then I was like, I actually like waking up whenever I want. I actually like doing whatever I want. I really don't want to have any babies, right? That lasted maybe 2 or 3 years, maybe four. Now I'm a little bit older, and I also have polycystic ovarian syndrome. We just came out of last month, PCOS Awareness Month, and it's both a blessing and a curse at times. The challenge is it can make fertility very difficult. The
Right.
blessing is it preserves your fertility in some ways, at least the quantity of eggs that you have. So on my journey, I had talked to God for years, decades really, and said, okay, if it is not your will for me to, especially like in the past few years before I started
Mhm.
this, I was like, if it's not your will that I have a kid, like the one good thing about trusting in something higher than yourself, it's like that's above my pay grade. Like the guy that said it's above me now, it's above my pay grade. So
Love
I don't,
bigger.
yeah, so I really don't worry about certain things. And it's not because I'm this great woman of faith. My
Yeah.
faith can be shaky, but it's really like I can't be bothered by that. Like I really
Mhm.
don't want to think about something that's outside of the realm of my control. So I remember saying, okay, if it's God's will, so be it. I
Mhm.
remember knowing that I was going, like when I decided to go through the IVF, I said, yeah, this is going to take. And I was like, and my friends were like, oh, you really know it? I was like, yeah. I said, all of us are going to be pregnant. It was me and my two IVF friends. I said, all of us are going to be pregnant. Technically, that happened. We all had varying challenges with that, but it happened. And if it doesn't happen, I'll have my hot girl summer at the beach with my husband with a sip of a margarita. That's fine. I'll be okay either way, right? And
Yeah.
then they do the transfer. And technically, when you get live embryos transferred into you, you're pregnant as long
Mhm.
as they stick. They have to implant, right? And so
Right.
I got three babies. Yeah, I got three blasts, which are, when you let them get to day 5 or 6 or 7, and they were day 5 blasts. So they were
Mhm.
live M babies that had grown and blasted out. And so they looked good and they put them in. And I rested that day. And the very next day, I'll never forget, my husband and I had gone to where were we at? TJ Maxx. We were in
Mhm.
TJ Maxx just doing shopping. And I'm pushing the cart, and all of a sudden, I'm pregnant. Like I literally felt it. I felt the moment that the embryo implanted. Like it almost pulled me down to my knees. Like I felt like
Mhm.
this gravitational pull. And I stopped, and he was like, "What's wrong?" And I was like, "I'm pregnant." And he was like, "Okay. Like what's wrong with you?" And I was like, "No, like it's happening now." And he was like, "Well, do I need to get you out of here?" And I was like, "Just give me a minute." And so I waited. I tested a little bit after that, like some days later, and it was
Yeah.
positive. I took a beta test a week
Wow.
after that, and the numbers were good. And then they set me up for an ultrasound. I want to say it was week 6.5, week 7,
Mhm.
and the baby's heart was beating and
Right.
beating strongly. And we got a chance to see the baby on the screen. The baby we called Lovey, because I didn't get the embryos tested to know if it was a girl or boy, so I nicknamed them Lovey, and it was like a really good time.
Yeah.
Surprisingly, I was growing really quickly, but I wasn't gaining weight. My belly was just expanding. And so it felt like, but I didn't have a lot of bad symptoms, not a lot of
Mhm.
vomiting or anything. And then comes 2 weeks later, 3 weeks
Mhm.
later, and it was 8 days and 8 day, however many days. So it was like 9 weeks almost. And I go for my second reading before, I'd already made an appointment with my gynecologist. This is the reproductive endocrinologist, because whenever you have fertility challenges, that's who you go to first.
Yeah.
And everybody's all excited to hear the heartbeat. I'm like, y'all won't let us take a picture of the screen, but we can at least record again, right? Because I recorded the first heartbeat. And they're like, yeah, my husband's all excited. He's holding my hand and nothing. And scans again, nothing. And I'm like,
That's like
okay.
that's heartbreaking. Like when you're sitting there in that moment, you don't know what to think.
Yeah, it was. I think like how you mentioned being like frozen. Like, I think I was just like,
Mhm.
but in my mind, I feel like I had been prepared either way, maybe. So I tell people all the time, there's a spiritual part of me that gets an understanding real fast. And then there's the other more human emotional side of me that's like, what's really going on? Right. And they
Yeah.
both coexist. in that moment, I feel like the spiritual side of me, it registered first that Lovey's gone. Our
Mm.
baby's somewhere in the not with me anymore. And I felt that the baby was gone. And I had looked up some things within that week prior because I
Mhm.
noticed I didn't have as much morning sick, which I didn't have very much morning sickness anyway, but something just let me know it's not happening. And my husband, he was like, what's going on?
Hmm.
And the doctors, the nurse tech and the doctor, they're like at me like horrified. They're like, I'm so sorry. And I was like, and you know, they were just trying to be kind and gracious. My doctor's a great doctor, but I was thinking like, when I get through with this, I need to come back and do a training for y'all on how to help support, how to assess, how to support people in a moment of grief. Because that
Oh,
overly saying sorry wasn't helpful to me. I just needed to know, okay, what's the next step? Like,
yeah.
I'm going to process later in the car. I'm going to process in the solace of my home. I'm not really going to process this here. So I said, do I
Mm.
get dressed now? And they're like, yeah, you can get dressed. And she was like, I want you to come to the office as soon as you get dressed. So we came out, and then it's like walking down a hall, and like all the nurses stations, I guess, had known. So everybody's staring. And that made my husband and I super uncomfortable. And I was
Right.
like, y'all really need to hire me to do a training on how to support
I had a
emotional health and wellness.
I had that experience walking out of the hospital too. Like everybody
Yeah.
knows, and I don't think they mean to, but yeah. And then
Oh
not
my
only that,
God.
when you're in the hospital for a long time,
Yeah.
like they get to know, like
Yeah.
Jordan was fashionista, so what
Yeah.
outfit Jordan got on today, and I
Yeah.
noticed that the ICU nurses,
Mm-hmm.
they were cold, but they were
Yeah.
just very, I don't know what the word, I want to say stoic. I don't know if that's the right word, but
Stoic, yeah. Kind of unmoved,
yes.
unwavering. Yeah.
Yeah, and I always wondered like why they were like that, but it's
Mm-hmm.
because in ICU, that's the risk of losing the baby. So
Absolutely.
like they didn't want to get to know the families and the babies because
Yeah.
what if they? But I mean, my daughter always smiled, so like it's
Yeah.
like you gotta smile back at her.
Yeah.
And so like I remember like getting the smiles from the nurses, and like
Mm.
it was just a thing. Like I know, like they didn't want to smile, but this is
Yeah.
like they couldn't help it. As some
Yeah.
because we're all human,
Yeah.
you try
Yeah.
to protect yourself so much, but
Yeah.
at the same time, you have a human part,
Yeah.
and I think that's what we experienced. Like,
Yeah.
and so when we were leaving, it was the same type of thing. Like
Yeah.
everybody's just they probably feel for anybody that loses.
Absolutely. I
Yeah.
think what I learned, because I know you learned a ton, like you learned so much about yourself in the
Right.
process, but then you learned so much about, you know, other people and how they navigate things. I think more than, and it's going to sound insane to some people, I know it will, and maybe I'll feel differently in another year or two, but what my
Mhm.
experience showed me when I went through it last year was my moment of grief. Like the deeper grief that I felt was because in that moment, I've always been able to intuitively know how to support someone else in their grief, loved
Mhm.
ones, even strangers. And some of it, yes, is me being a therapist, but my friends will tell you, even before I became a therapist, when I was a kid, I just intuitively knew how to support.
Mhm.
And that's always been an issue, me having someone that could reciprocate, intuitively know without me having to navigate telling them and explaining and over explaining. And so that's always been an issue since I've been a child. But you're reminded of it in times when you're in another space of grief. And so I just remember I had told some people, not a lot of people, but I remember drafting up a text message on the way out of the hospital while my husband was driving. I think maybe I was in the car. And I just copied and pasted, sent it to everybody, like the same message, and was basically like, we're okay, but don't expect us to be contacting. Like what I
Yeah.
realize, especially with women, I'll say there is a need to, because most people, like grief is different for everybody. And so
Mhm.
typically speaking, people need to get it out. They need somebody to lean on, to cry.
Yeah.
But any type of time when I've had moments of grief, I'm an internal processor first. So I tell people all the time, when you
Mhm.
have that committee of 20 going on at one time, I need to be
Mhm.
like, which is me and God, then me
Yeah.
and Dave, my husband, then
Mhm.
I can communicate to the general masses. But I was
Yeah.
feeling a pushiness from others, like, Like it would be people who, I mean, they were nice, but we weren't like really close or anything. And they'd be like, you can call me if you need to vent or cry. And I was like, I don't.
I'm
And they're like,
not.
well, you don't have to be strong. And I was like, I'm not being strong. Like I feel grief, like I feel sorrow and sadness. And
The
then I
common
think,
thing to say, right?
yeah. And I was like, but the fact that you're making me have to explain this, that's grieving me deeply. Because
Yeah.
why do I have to say or do anything to, like, I'm in the center of the trauma circle right now. I need
Mhm.
support in the way I'm asking for it. And so if you don't know me, then really don't say too much. But if you know me, I need you to trust me when I say, I need you to let me handle this my way. And, you know, when my mom offered to come, my best friend offered to come, I told them, don't come if what you need to do is be needed or feel like you want to sit with me and talk about it. If I feel like talking about it, I'll talk about it. If I don't, I won't. And so you
Mhm.
being here, I don't want to feel the need to emotionally caretake for you so
Yeah.
that you feel like you're being helpful. Because then that's
Yeah.
again not
Yeah.
helpful to me. And so I'll never forget having to set new boundaries and parameters and explain things. And like some people were really great. Like my sister was really great about it. My best friend, after I talked to her about it, she was like, I totally get it. And,
Mhm.
you know, but we had that kind of relationship where I could say, hey, listen, you can come up. I need you to come up. And if I'm just chilling, if I don't want to get out of bed, if I'm just watching TV, come up because you just want to be around me, not because you want to
Yeah.
deal with this. And
Yep.
that's what she did. And that's what we did. But the bigger part was knowing what's next, because I think you and I talked a little bit offline, and I'm going
Mhm.
to have you talk about it in a second. But we talked about what happens when there's other factors to your loss. So, like for my
Yeah.
loss, I was 44.
Mhm.
One, there's financial barriers because we're at this point, we're capped out with our IVF fertility benefits. So, we have four more M babies in the freezer, but we have to pay out of pocket for meds and the transfer and stuff, which is
Mhm.
pricey, right? And so, two, I just turned 46 because I was 44 the beginning of the year, right? I was supposed to have the baby. Lovey was supposed to be due in October, and which is also my birthday. I know you said the 29th is your birthday month. The 8th is my birthday. And so the baby was supposed to be due towards the end of the month. And so last month I felt it come up for me. And then this month I'm like, my interest, I'm always very introspective around my birthday. That's my new year.
Right.
But it's doubled now. And I am aware of the time constraints
Mhm.
as well. So some of it is grief around losing the child
Yeah.
I instantly connected with, which is so weird. Like I didn't make it to my second trimester, but I knew from the moment they put the babies in, I knew from the moment like this is it.
Yep.
This is our baby, right? And then to get to a place where you're like, I don't even know if we should go forward and do it again. Like, I mean, if we naturally ended up pregnant, we're not trying right now, but if we naturally do, the
Mhm.
whole journey then is you never know what happens, especially once you hit a certain age. It really
Right.
is just between you and, you know,
Mhm.
for other people, their higher power. For me, God, it's really between me and God. Like, tell
Yeah.
me what to do, big dog, because
Yeah.
at this point, I don't know. But I want you to talk a little bit about what you had mentioned before around loss being different for folks, especially infant loss, when you have other children versus when that is your only child that you've lost.
Yeah. So as you were talking, I was just thinking about the updates that you have to give, right?
Yeah.
And
Because they do ask.
yes, and so I created a Facebook page, and that's where I kept everybody updated. I was like, "Hey, go follow this page because I don't want to keep telling, like, especially when bad things were happening, like the breathing tube, the strokes, the whatever else we went through that was just horrible. Like there were good moments too, but those bad moments were hard to talk about. So I'm like, instead of everybody texting me or sending me a private message, just please go to her Facebook page. I'm gonna update y'all. And I'm very transparent and I just always have been. And so when one news came out or the reporter calls for a follow up or whatever, cool. I'm like, let's talk about it. You
Yeah.
know, because I have never felt the need to censor myself around that, like, especially
Yeah.
when I was trying to like fundraise and get the funds to go to Boston.
Same.
And I also when she died, I didn't have the funds like do a funeral. So like
Yeah.
again, I'm thinking about a story, and I'm like, well, everybody wants to know what happened, so I might as well get a news person to update so they can read the paper and or the story and see what happened. And that way I'm telling it one time,
Hmm.
and you can go to that newspaper story and see what happened or the Facebook update. And then
Yeah.
I know, like, one of my friends had posted something on Facebook, and rest in peace or whatever.
Yeah.
And I got home and there was like 200, 300 messages or comments on my page and stuff like that. And luckily for me, I got to the point where I went on there, and it was just a lot, but it was for me
Yeah.
to see that. So I know, like, updating is one of the aspects. Everybody does want to know what's happening. Sometimes you have to keep repeating it and reliving it over and over
Yeah.
again.
Tell people to wait for, like, I remember telling people through the journey, I remember telling people, I don't want to be asked, but I will, because I'm like you. I'm very authentic, very vulnerable, very transparent, but I want to provide the information. When I
Hmm.
provide the information, just because you think we're cool, don't inbox me, don't text me. The information you get, trust me, that's all I'm giving. And that's
Yep.
in everything. So I don't need the, if you're praying for me, that's great. I don't need you to reach out separately because that's extra maintenance I have to do. So did you kind of, I had to be very tight with boundaries for my own mental health and peace. Did
Hmm.
you have to, like, in addition to the Facebook group, like, even with people close to you, be really kind of like, I love y'all and I know y'all hold me down and this is how I need you to navigate right now?
Yep, I had the boundary set. I remember one time, one of the pictures, I guess you would say it went viral because a lot of people were on it, but it went
Mm.
viral because people were being very mean.
Oh,
And
God.
so one of the ways that I was able to stay in Boston, and not a lot of people know this, is
Mm.
because I applied for the homeless shelter. And
Mm.
so when you have a sick child and you apply
Yeah.
for the homeless shelter, they give you a hotel room.
Okay.
And so you're not like in a shelter, but you're in like the shelter hotel.
Got
And
it.
so
I
in
thought
the
it was like the Ronald McDonald House. I know they
well,
have
so
the.
in
Mhm.
Boston, so when I stayed at UVA when
Yeah.
she in the NICU, I stayed at the Ronald McDonald House.
Got
But
it.
in Boston, because Boston's huge,
Yeah.
the Ronald McDonald House is typically children with cancer, their
Got
parents,
it.
because they're going to be there a long time.
Hmm.
And I even called them and I told them, hey, she doesn't have cancer, but this thing is a long term thing. And it was already full. So I was like, what else can I do? So this is me trying to figure out what's next. We stayed at this place. It was called the Yawkey House. And
Hmm.
I think it was like $25 a day or something like that. That adds up when you
Yeah.
get there for a year.
Oh my
And
gosh.
so we had to figure something out. And
Yeah.
so that's why I went the route that I did. And so in this picture I posted, so mind you, when you're staying in a hotel room and you're living there, you have everything everywhere. And
Yes.
so on the sink there was, I think it was like palm olive or Dawn or something. There was dish soap on
Yeah.
the sink. There was like pads on the sink and something else. I'm taking a picture of my baby. I'm not looking at everything that's on the sink, right? I'm
Yeah.
just like, look at her. She's ready for bed. We just had a bath time or whatever. And somebody had commented like something about the pads on the sink and did you wash your baby in dish soap? And it was just a lot of ignorance. And I was asleep when this was happening, but
Yeah.
my where my hometown I'm from in Front Royal,
Yeah.
Virginia, they were on it. They were in the people that were being mean, and I was like, wow, that's so ignorant because you don't know my story, you don't
Yeah.
know what was happening at the time, and then some of them were like saying stuff about my baby and all type of stuff,
Even
and
knowing what you were going through with the baby.
I don't even know, did they know? And I
Yeah.
was just like, wow. So because that is the power of social media, right?
It
Like when you
is.
put it out there,
That's why I always say I do not want to be famous. I could. I don't.
no, I don't have that desire at all.
Nope.
But I do check the background of my pictures now.
Yeah.
Because
Is
look,
that
even
why at the beginning you were like, "What's?"
around, like, okay, can anybody? Because I mean, don't get me wrong, my office is pretty. I'm tight, but
Yeah.
I don't. I ever since then. But that's the thing. So
Yeah.
like, that was something else, like another struggle. But yeah, the marriage was a piece of it because a lot of couples do get divorced after child loss,
Yeah.
and I really didn't want to be part of that statistic.
Yeah.
But I also felt like if I'm gonna do this by myself, I'm gonna be by myself,
Yeah.
and it was. Like now we like can have a conversation, but I
Hmm.
hold the work that I've done. But that was
Yeah.
definitely a struggle. Also a struggle for him too because he wasn't there,
Mm.
at the last moment. So,
How does he grapple with that? Have you guys talked about that part? Because one, our daughter's fighting for her life and you're not here with
mhm.
her, but also you're not here to support me. And then I'm sure like then once she's gone, she all talked about that at all?
Oh boy, it was ugly at first,
Yeah.
but it's definitely
Yeah.
at first it was very ugly, and I had so much resentment and hatred that I was like, you know, images in your head. Like
Mm.
I had nightmares for months, replaying the event over and over
Yeah.
again, and
Yeah.
then just wanting to wake up and pick her out of her crib and just snuggle with her or something, and I couldn't because she really is gone.
Yeah.
And so I'm like, you'll never have those images in your head.
Yeah.
And I mean, he definitely kicks himself for not being there and stuff like that.
Yeah.
Like in later years, when I was able to do some work and mature, I was able to talk because I did talk to him before writing my book. Like,
Hmm.
hey, you're about to be in this, right?
Yeah.
Um, we talk about that, and then we were able to kind of talk about some of the stuff from a healed place rather than a hurt
Hmm.
place. And
Yeah.
so, like some of the challenges that we had to go through together
Yeah.
immediately as a married couple, and then being just so young. So
Yeah.
we did discuss that, and it is, and can have a conversation, and it doesn't
Good.
change anything in the past,
Yeah.
but it definitely helps to know that because sometimes I forget that he grieves too. Like
Yeah.
that was so far in my stuff that I was like, I
Yeah.
had to be there by myself. I had to. He said, he offered support if you want planning, but I was like, I don't need your help. Like,
Yeah.
I went ahead and did my thing.
Yeah.
I designed her tombstone.
Mm.
Luckily, my hometown was donating to the funeral home,
Yeah.
so her funeral ended up getting covered by
Good.
like just kind-hearted people.
Yeah.
So I was able to have her funeral.
Yeah.
I was able to do those things, and it was just so much ugliness from his side of the family and stuff. So
Mm.
it was, yeah, after that we still tried to be our word,
Yeah.
and it just too far gone.
Yeah.
And so that was really hard. So not only do you lose a child, but then like that part, and then like I was saying, I lost my dad too.
Yeah.
And so all of that was all at once. And it was just so many losses of like after that I got my associate's degree right
Yeah.
before my dad died. I had just finished. I would be in the back of my daughter's room. Like they
Hmm.
always have like a bed or whatever in the back.
Yeah.
I'd be in there with my laptop, just checking away, trying to just pass the time and do something different. And I remember getting my degree, but it didn't really that much because there's so
Yeah.
much going on. I do remember my dad couldn't talk by the time that he was getting ready to go.
Yeah.
And I told him, I said, Dad, I did it. I got my associate's degree. And he smiled. And I was like,
Yeah.
oh, he knows. Like, it
Yeah.
was just a moment. So I'll never get being able to tell him that.
Mm.
And that's one of the things I thought about like recently. Like, I did keep going. And
Yeah.
like, through everything, then that's just a little chunk of life, right?
Yeah.
But
Absolutely.
everything, like I still kept going, and that's what I do because I want people to know,
Yeah.
like it doesn't matter how many things we go through, how
Yeah.
many challenges are compiled on top of each other.
Yeah.
We can still work through it.
That
It's
part.
gonna be hard. It's gonna take some time, but we can still
Hmm.
work through
Yeah. And I think it's what you said, almost like I feel like there's a balance of finding the strength to through,
it.
right? But I was telling somebody the other day, I was saying something about building. I realized the older I get, I continue to resiliency so that I can show up. It was a
Yeah.
friend of mine, a really good friend of mine, and she was like, yeah, but I'm tired of just pushing through and showing up. I said, well, wait a minute. Here's the caveat. We're not quite about the same thing because with her shut down and just
Mm-hmm.
keep doing it,
Mm-hmm.
right? Like
Right.
I'm just gonna push, like she's legitimately pushing through, ignoring the signs. Her body, her mind, her heart is tired.
Yeah.
And it's hard going through that. And at the same time, I know we all have our individual process. It's not like I don't
Mm-hmm.
understand why she's feeling like that. I get it.
Right.
And so all I can do is pray for her, be there to support her if and when she allows me to, right?
Mm-hmm.
But what I told her is I said, my push through is different. My push through means all the things that I wanted to push through and do don't get done. If I'm not right, if my heart is broken, if grief
Right.
has hit me, if sadness sessions, I'm going to mock the self care that I talk to them about, that I
Right.
advocate for them about, right?
Exactly.
That by, showing up for me.
Exactly.
So when I am depleted, when grief strikes, when anything, and the thing, grief, it's an ebb and flow. Like
Mm-hmm.
I'm okay right now, right? Like you and I were talking about being able to tell the story. The
Mm-hmm.
reason why I speak so passionately about my hardships is not because my hardship is my narrative. That's
Right.
not my total identity, but I'm not mistaken that it has helped to create who I am today, one. And
Absolutely.
two, I asked God way back in 2003 if he got me through that first marriage
Mm-hmm.
and the self-suffering that I was doing, if he could show me the purpose in the pain, I feel like I can make it through pretty much anything. Life has proven that to be true. Now I'm not going to test them like please don't send nothing else, Lord.
Mm-hmm.
Don't send out another thing. Let me catch my breath. But
Let longest soldiers, they always
listen,
say.
I'm not Miss Soldier, Lord. I'm not. So please don't send no more. But and thank you for showing me the purpose and the pain, because I tell
Yeah.
you, no sooner than I dealt with my own loss. So I had my procedure. I got pregnant in January. Got had my procedure April 1st, and by July, I had a client reach out to me who had a similar situation that happened to a friend of mine earlier this year, where she had to have her pregnancy removed in her second trimester.
Yeah.
And this particular client had had other children successfully and just like got pregnant and was happy and excited, and lost her mate before not like they broke up
Mm-hmm.
before, like a week or two before. So going through this unimaginable pain and sorrow, and I get this call, and I think I told you before we started the show, I don't, as a therapist, I don't see people for grief and trauma anymore. That is your jam. That's not my jam anymore. So, right. So I was like, okay. And, I always try to help. So there's a lot of people that call me like, Sherrae, I need to see you. This is what I'm dealing with. And I'm like, I'm not going to be able to see you, but tell me
I know
what you're
somebody
looking for.
that
Exactly.
will.
I'm
Mhm.
always going to try to do a warm handoff to somebody, like try to find somebody for them. And
Mhm.
so I used to do complimentary consults, but I used to do 30-minute complimentary consults. And I remember having a consultation with her, and I was just like, it was almost an hour. And
Mhm.
I couldn't get off the phone, not because she was like holding me up, but like
Mhm.
I didn't feel comfortable just pushing her off. But I'm like, but God, I don't do this anymore.
Mhm.
And so, like, I thought about it and I said, okay. And she was like crying. Like, I was talking to her about things. She was like, I feel like you're who I need. And a friend had referred her. And I was like, okay, I said, I want to wade in the waters of grief and loss in that way
Mhm.
anymore. I acknowledge it, and I acknowledge yours. And I want you to have the space that it takes. But our primary focus in working together would be about you and your identity and how it's responding to this grief, and how the grief is impacting said identity. And so I want to make sure that that works for you, because there are people that can help you through grief and loss. And that's a traumatic loss, like a super traumatic loss.
Absolutely.
And she said, I think when I got off, I told her, think about it. That's what I told her. I said, think
Mhm.
about it, because I didn't want her to think I was pushing her away. And I
Right.
really didn't feel firm no, because I was like, why am I staying on the phone with this lady so long? But there was like a pull, there was a tugging. And so she
Mhm.
ends up, and the other thing is, I had just recently lost my pregnancy. And I'm like, I think I'm okay. And at the same time, I don't want to do harm. As therapists, we always have to assess
Right.
our own selves. And I'm like, I've not cried. I've been okay. I know that I'm grieving, obviously, but I grieve very differently. I don't know if it's the neurodivergent brain, but I grieve a
Mhm.
bit differently. And so I'm like, okay, let's see. And so she calls me back and she says, it needs to be, she was like, I want to schedule. And I said, okay, are you sure? Because the rates were a thing too. I didn't take insurance and my rates were a little higher.
Mhm.
And I didn't change my rates for anybody. And she said, it's worth it. And I believe you're the one. And wouldn't you know it, we still work together. We talked about how there is this synergistic flow that has happened. I was supposed to get her. And so sometimes it's not that I'm like, oh, yeah, glad this happened to me because then now I can hold space for my clients in a different way. Absolutely not.
Yeah.
And if it was going to happen anyway, I'm grateful that I was able to utilize
Mhm.
that deeper level of empathy, awareness, and understanding to hold space for her in a way. Just kind of like when you said when you went to the therapist and was like, you know, I don't ever want somebody to come to me with their sorrow and their grief and be like, what is she talking? No, this isn't.
Yeah, because it was not helpful at
Yeah.
all. Well, I won't say at all. I'll give her a little bit of credit because she did help, but it wasn't what I needed.
Yeah.
And I tried therapy a couple times before I found the right person. So I will say I have now found the right person,
Yeah.
and doing EMDR therapy helped me a lot
Mhm.
in combination with talk therapy too.
Yeah.
But that it just really helps. And I because they quit one person that they didn't like or whatever
Yeah.
happened. I'm like, okay, maybe they just weren't for you. Like maybe you
Yeah.
should try someone else. Because I think I tried maybe like 3 people before I found that person for me. And then I started, and things started looking better for me. And it felt, in the
Yeah.
meantime, I was still like doing stuff for myself, but just not therapy. But
Yeah.
when I did that, there's a game changer. Like,
Yeah.
I really do feel like, and I'm biased because I'm a therapist, but I
Yeah.
feel like everybody, if they allow it, could benefit from therapy. Like, I really
Absolutely.
believe.
I want you to
So,
talk a little bit about specifically the approach that you use though, because I feel like how you said, I feel like everybody can benefit from therapy. I feel
mhm,
like when we're talking about women, specifically around this topic around infant and pregnancy loss, I think that there is a level, well, one, because we are in such a patriarchal society, there's so much burden placed on women
yeah,
around being mothers where it's not that the men don't deal with grief and loss in the same way. It's that we shoulder a lot of responsibility, even especially for like things like pregnancy loss. Like, what did I
yeah,
do wrong with the baby? Was it my eggs that were old? They're never like, is it the sperm that, wacky? Like,
yeah,
it's like, is it my eggs?
mhm,
Am I the reason why? And so there's so much stigma, so much anxiety,
mhm,
criticism, so much depression. Like, I'm in a ton of fertility groups, for example. Most of those women have experienced multiple kinds of loss, from chemical pregnancy to miscarriages to having to bear their child and their child, or the child had some sort of infant had some sort of chromosomal disorder that ended in them having a painful few months and then they passed. And so, in knowing women like that have gone through that, me having my own experiences with, I had a real growing up that ended up having a spontaneous abortion, which they call it when the baby miscarries basically, but she had to deliver like in her
mhm,
home. And by the time I got to the hospital, we could go see the baby. And I held the baby. Well, she really chose the name. I just approved of it. And
mhm,
we had to, a little burial for the baby there. And to know the parents, we were really young when all that happened, like maybe 19, 20,
mhm,
like really young when that happened. And then some years later to have another friend and coworker who the whole pregnancy, her already had a child, but she was pregnant. We worked together and she knew that her child had a rare chromosomal disorder. They said there was a very little chance that the child would live very long after birth. It could be some minutes to hours to days or weeks. And so she chose to, they kept saying, you can abort the child. You decided that she wanted to. She was just like, I'm going to pray, but I'm going to have regardless. I don't
yeah,
want pregnancy. And so, we were working in a pretty public place. People would see her with her belly and, ask her about her pregnancy. And by the end of it, I remember going to the hospital to see her when she delivered, and she was in the room, her and her dad, her in the room, like just with the baby, talking to the baby and just passed on. And
mhm,
she just wanted to spend that time. And she took pictures and like a lot of things that I think people forget about.
yeah,
Those are things that I think people are afraid that it may haunt them. But once those pictures aren't taken, you don't get that time back. You don't, get the time. And I remember that was the first actual funeral of an infant I attended. The other funeral took place, we did it at the hospital, but this one, she had the casket and the dress, and my mom sang at the funeral. And I just remember feeling such deep sorrow for her in
Mm-hmm.
the loss. So in my mind, this was my late 20s, I think, early 30s, late 20s, early 30s. And in my mind, I just remember thinking like, God, I don't think I could handle it. I didn't think I could handle a miscarriage. I said,
Right.
if anything took me out, if anything made me say, it would be finally getting pregnant after a doctor told me at 16 I'd never have kids.
Mm-hmm.
And so it was like, that's going to take me out. Like, don't take something from me that I've always wanted. Like, I just rather not have it. Right. And then it didn't take me out. Right.
Mm-hmm. Right.
Because the perspective came, and I thought to myself, I said, well, at the time, I believe it was Kiki Wyatt, she was pregnant with the baby that is an infant. And the baby had one of the trisomies. I don't remember which one. Trisomy
Mm-hmm.
21. It was one of the ones that they found in the second trimester. And
Mm-hmm.
that happened literally 2 days after I found out that my baby was no longer making
Mm-hmm.
it. And so in my mind, the same way I feel like I couldn't deal with miscarriage, I feel like I couldn't deal with your story. I couldn't deal with her story. You never know what you can get through until you have to get through it.
Very
And
true.
so in my mind, it's like, I don't get to control any of this. And
Mm-hmm.
so if Lovey left me then, my only thought, I guess, is perhaps it was because there would be some greater pain that would have come later. Now, it may
Mm-hmm.
not be true, but we
Right.
tell ourselves what we need to tell ourselves,
Yep.
to comfort in that space. I felt like, you know, a lot of times the women that are going through this don't give, like, I can't tell you how many groups I'm in where I'm like, listen, I'm a therapist and you absolutely come to me, but
Mm-hmm.
please go get therapy, not because something's wrong with you, not because you're sick, but because we're hurting. This is a hard process. This
Mm-hmm.
is a lonely process. Even though we have all these people, you feel
Right.
loneliness. And then once you've experienced loss, and I have friends like this, there's the fear of even getting pregnant again, because it's
Yep.
like, even my client was like that. Like, I
Mm-hmm.
get pregnant again, and then what? Like,
I
I
just did
can't
a
go.
talk talking about just coping, and then
Mm,
also like that fear, like
yeah,
doing it all over again, and things like that. And that was a component to
yeah.
other like therapists.
Yeah. So I want to make sure our guests have some takeaways, because, like, the big part is I just wanted us to
Mhm.
share our journeys and then honor
Yeah.
the journey for like what it's been like for us. But we talked about therapy. I know the kind that I provide to my clients is more around navigating the journey of who am I, especially my particular client. Her entire role, because she was already a mom, was about being a mom. She
Hmm.
had not realized that she hadn't kind of teased out these are different roles that make up her identity. So the work
Hmm.
we've done has been huge for her, but also for me in
Yeah.
my process and my growth. Because I feel like, I think Dr. Yalom said we're fellow journeymen, right? I'm usually only a step or two in front of where my clients are, to try to help facilitate their process. With you, with EMDR, I think a whole totally different game changer with therapies like EMDR, brain spotting, somatic experiencing. There's
Hmm.
so many different trauma-based models that I don't implement that are super, super helpful. And I just give some like real practical suggestions or feedback around if somebody's listening and they're like, I know their therapist talking about therapy. I don't know if I want to talk and cry all day. As a therapist, I didn't really even know the process of EMDR. Like, I know what it means. Like, eye
Hmm.
movements, like, I know what it stands for, which I want you to explain to the public what it stands for.
Hmm.
But how does it shift? If somebody were to go, who should look for, how should them, how do they navigate finding help to say, I want to heal in a different way?
Yeah. So I love EMDR. EMDR stands for desensitization and reprocessing. It's a therapy modality that if you don't want to talk about it and share all the details, you don't have to. Before I learned EMDR, when I used to work with active duty soldiers, we would do a lot of exposure therapy, and it worked. It's just a painful process. So I learned like written exposure, which is still helpful because you write down all the things. But EMDR is not exposure. And So, yes, you have to tell me what you're working on, but at the same time, you don't have to tell me every little detail. You don't have to relive it. You can create space from you in that thing.
Mm-hmm.
And so, one of the techniques that we use, like as you're processing that trauma, we say, like, imagine you're on a train and you look out the window and you're just watching it go by, so that you're not reliving it. You're watching it, yes, and you're observing the experience, but you're not in and reliving that experience. And that tends to help a lot of people kind of make some space so that they can observe the experience. And the idea is that the trauma is a stuck point and you want to be able to move forward from that. And typically, so for my personal was that I felt like a failure. No, that's not true. And I know it wasn't true, but I felt like a failure. And so I had to work on that. And so we took that negative cognition, and you do sets of bilateral stimulation, and that could look like tapping, like you could tap on your legs. You can we had buzzies in the office where they buzz left and right. There's audio that you can listen to a sound left and right, or there's eye movement where you watch, somebody could do their fingers across the screen, or there's like a ball when you do it virtual, you can watch that across the screen. But there's many different ways to do the bilateral stimulation, but that's what lights up those areas of your brain. It gets you in that right part of your brain where you're feeling stuff. And so one thing that works well with feeling that kind of stuff is when you get into that target, I'm looking for what was the worst moment? What's the negative thought that goes along with it? So again, mine was I am a failure. And then I think about what would I prefer to believe? I prefer to believe I'm not, right? And how true does that feel in that moment? In that moment, if I'm thinking about that memory and I'm thinking about I'm a failure, I'm not feel true at all. So I kind of get to rate that on a scale because it's going to change as we do the work. And I think about what am I feeling in my body? What feelings are coming up as I'm thinking about this memory? Then we do the work. We do sets. The therapist is going to check on you like every 30 seconds, every minute, or something like that as you're tapping. And when you stop tapping and you check in, you get to go back to that memory and you're like thinking about it. And you get to see, like, note what changes, note what comes up in your body, because it's a brain body thing. And as you continue to process, your brain is moving towards adaptive information. So your brain wants to be healthy. It's looking for those good things. And so I am a failure becomes I'm not a failure as I start to process through all of those things that made me feel like that. So the brain is allowing me to look at all of that stuff and work through that so that at the end of that session, I no longer feel like that anymore. It's not true.
Mm-hmm.
And so I can be in alignment with what I know is true. I know I'm not a failure. So it's just working through that stuck point. And I don't have to talk a lot about it. When I stop and check in, I can give the headline and say, I feel like there's a pit in my stomach. Okay, do another set. Tap in. Okay, this time I noticed that the lights were off or something like that. Like you'll notice something every time. And whether it's a feeling, sometimes people report their feelings. Sometimes people report what's happening. Sometimes people have a whole something going on. There was lights and something went down the drain and all of that. And so the thing about art is a very approach. Somebody told me their memory turned black and went down the drain, and that was that it was over, but
Mm-hmm.
that was the way that they visualized it. So I'm like, okay, cool, go with it, you know. But that's the thing. Like, I don't get to judge their journey. I'm just helping them process. They are really
Mm-hmm.
doing the work. Their brain is doing the work. So it's a lot of free association. You
Yeah.
just allow your to do it. Your brain is going to come up with the narrative, and you're going to go with it, and you're going to see what happens. So you have to get a trained therapist that knows what they're doing to be able to help you through that process. And EMDR, they are a great source for that. And
Mm-hmm.
I got certified through them. And a certification is something that you have to earn. It's not just something that you're given by doing a class. You have to complete basic training. You have to complete EMDR with a certain amount of clients and earn those hours and do that consultation. So like when you get somebody that's EMDR trained and you get somebody that's EMDR certified, like those are
Mm-hmm.
the people that have went through what they need to get through to get that. And you
Yeah.
can go on their website and you can search, click find a therapist. You can even put in your insurance or whatever, and then find someone in your area that's IMDRIA trained.
Yeah.
And so there are other agencies that train, but I'm
Mm-hmm.
always going to go hard for IMDRIA because I know what they produce,
Yeah.
and I love that. And it's really easy to therapist on that website that does take insurance that's in your area. A lot of therapists are doing virtual therapy, so that is a thing. EMDR
Yeah.
is effective virtually as well.
Mm-hmm.
So, if that is a good site. Psychology Today is always good for finding therapists and looking for their bios and things like that. But another thing to look for is how much you have. Like, what are your supports
Mm-hmm.
outside of therapy, right?
Yeah.
Even if it's like journaling or talking to a close friend or something like that, you want to make sure, like with grief, that you're not avoiding stuff. Like to
No.
me, that's the biggest thing. When somebody comes to me and they want to work on a loss, I want to know like how has that loss changed your life?
Mm-hmm.
And what do you miss about that person? And I'm actually going to talk about the relationship and what was
Mm-hmm.
their name? Like, can we talk
Mm-hmm.
about their name? Can you use their name?
Mm-hmm.
And we want to go back and talk about those because we want to honor them and not be afraid of them. And
Yeah.
that's what's going to allow you to move forward because that thing no longer has a hold on you to where you're like, I'm not going to think about that.
Yeah.
That's going to make me sad. No, it's okay to be sad. It's okay to
Yeah.
not be okay. It's okay to fall apart.
Mm-hmm.
Intense emotions die down. They absolutely do. So what do we
Yeah.
do in the meantime? We feel
Yeah.
it. You got to feel to
Yeah.
heal. I tell people that
Yeah.
all the time. So I hope that, people that are listening to and they're just a little bit curious about like what they could do. They
Yeah.
could try some therapy because that would be good. Also, there's
Yeah.
books out there. Let's say therapy's not your jam. It's okay to read a book. There's
Yeah.
lots of books. I don't know if there's a lot of books by licensed therapists, but if it's me and I'm looking for a book, I licensed therapist because I want to know,
I was going to ask, do you have any recommendations like based on these sorts of things?
So, I don't want to say his name. I think it's David Kessler
David
who
Kessler?
wrote a book. He wrote the sixth stage of man.
Mm-hmm.
So I thought his was very good because
Yeah.
he taught
Finding meaning.
finding
Mm-hmm.
meaning. Because one of the things that he said that I thought was great was he was like a witness of a mass shooting,
Mm-hmm.
and I think I don't know if his mom was in the hospital or if he lost his mom, but he lost his child. His child was in the 20s. And he said, I don't know about this acceptance stage, right? Like,
Yeah.
but finding meaning though feels a little bit better. As you know,
Mm-hmm.
we all have a personal journey with grief. It doesn't look the same
Yes.
for any two people. And so finding meaning, I think is really important. When I was writing my book, that's something that I talk about in my book as well. I
Mm-hmm.
talked about the meaning behind
Yeah.
that's what's special for me. Like
Yeah.
I had to put some sort of meaning to this thing,
Absolutely.
and my meaning is others and letting
Yeah.
them know like we don't have to stay stuck, we don't have to stay down. We can
Yeah.
be happy and sad at the same time. Two things can be true.
That part.
Yeah.
Can you the name of your book?
Oh, my book
Because
is
you
called
actually have two books.
Yes. So I have to. My book is called Holding Space.
Mm-hmm.
And I talk about rather than just surviving.
Mm-hmm.
And so I do share my grief story, which I've shared a lot here, but I didn't share, the little intricate details. And then it talks about a little bit about my military career because I think that was a part of a very strong part of me as well. And then
Mm-hmm.
I like what it like for me to get through that so that you can apply those things as well so that you can get through your grief journey and heal that way. And I also
Oh, sorry, go ahead.
sorry we were overlapping. So my other book it's not a long book, it's a separate book, but it's
Mm-hmm.
a workbook and it talks about like your stuck points, like
Mm-hmm.
where are you stuck in. It's more generalized, not towards grief, but it talks about like where you're stuck and it kind of just gets you on the track of creating a better mindset for yourself. I'm gonna
Yeah.
write a workbook that goes with my book because I've had a couple people ask me like, where's the
Yeah.
work that goes with your book? So I'm like, okay, hold on, I'm working on it.
Yeah.
So I will be doing that. But that is, I want to find, people that need that kind of stuff, and I want to be able to offer that to them.
Yeah.
And just those type of that are healing towards us. I know not everybody's gonna go to therapy, so
Yeah.
that's okay. We
Yeah.
here's some books, that will help you through your journey, or what something that'll just help you just push it.
Yeah.
There's also another book. It's on my bookshelf. I believe. Oh my goodness, I don't remember what it's called, but it's Love. I think it's Love After Loss, and it talks about what go through loss and then
Mm-hmm.
love again. And
Mm-hmm.
so that's a component of it as
Yeah.
well. So I think that is a good way to kind of like start your grief journey. If you're not ready to jump into therapy, journal so you don't avoid your thoughts. If you need
Yeah.
some journal prompts, Pinterest got a lot of them for free.
They do.
YouTube has a lot of free meditations. I can't recommend any of them personally because I just type in "I'll leaves on the stream" because I know that's a
Mm-hmm.
technique that helps distance you from your thoughts. I'll type that in and I'll just click on a couple to see which one I want to do.
Yeah.
But there's a lot of free resources out
Yeah.
there on YouTube and Pinterest.
Yeah.
There's also like if you want to buy a book or something like that and try that out, there's a lot of good books out there as well.
Yeah.
So
I was going
yeah.
to actually recommend one that I've heard about. I myself have not read this book, but it's called A Piece of My Heart, Living
Mm,
Through the Grief of Miscarriage, Stillbirth, and or Infant Death. And
mm,
that is by Molly, I think her last name is Fumia.
mm-hmm,
And it's basically just an account of how, and it's a personal account, so it'd be like one of us writing a book about how grief at the loss of a baby can eventually lead to healing. That's her account of what happened for her. And so I've heard about the book. I've not read it myself, but as Arielle was saying, if I had to leave our listeners with anything, it would be that anytime something tragic or traumatizing is happening to us, I'm one of the first people to say, please do not tell me, oh, it'll all get better. Because what if it don't? One. And two, I don't need to hear that. Because even if I believe it does, I don't need you to tell me. Because right now, you're
yeah,
not in the center of the grief, right? Let
the
me,
time will
right?
heal all. Time heals all. I hate that.
Yeah, and God gives life and takes it away. Like there's just so many cliche,
You
horrific
can have another.
sayings.
Yeah,
Yes. Like you're
like.
still young, you can do it or you can adopt or just whatever the thing is. What I
Mhm,
caution people that may be listening to this is if you've never dealt with infant or pregnancy loss, it not that every
mhm,
loss doesn't is important, but it is different. And so in sometimes in both identify to relate to help support of somebody else and recognizing you couldn't stand in their shoes. They may not be able to stand in your shoes either, but the pain is universal. The way
yeah,
in which the pain is hitting us and how it's impacting us is unique to us. And so, if I could give any message to anyone, to the listeners who have not been impacted directly in terms of something, you've lost your pregnancy and or you've lost your child, you've had to bury your child, whether it is, mother or father, if you have not experienced those things, and even if you have experienced those things, each person's situation is so unique and different. A pregnancy loss is different than an infant loss, and yet
yeah,
loss is loss. And so being tender and what you're saying, remembering that it is better to ask for the best ways to support people versus just administering support the way you think is best. And even as a therapist, I have to tell people all the time, I don't base prior to something happening for you to say that that would be welcomed. I don't just assume it'll be welcomed
yeah,
because
absolutely.
it can feel burdensome for somebody to have to tell you, I don't want support that way. So,
Hmm.
sending someone a message or sending something to them that they don't have to respond to you in their moments of grief or sadness or sorrow and whatever that may look like is
Hmm.
probably the best bet. Offering supports if needed. If somebody really close to the center of the trauma circle has said this is what this person is needing, maybe taking a cue from them, but also remembering that sometimes all people need is space and the resources that they're determining. If people don't know what resources they need, then by all means offer
Right.
some supports. But if they do know, navigate that
Hmm.
accordingly For the women who have experienced this, or the persons who have experienced this loss, the moms and dads out there that have experienced any of these losses, because my husband also experienced a loss. He didn't carry the pregnancy, but that
Right.
was our loss, right? And so, and the
Uh-huh.
same thing with your husband as well. And so, for anybody who has been in that space, it doesn't matter if, gender doesn't matter. The loss is what matters, and honoring your feelings about that. Just like Arielle said, you can be in a space where you can both grieve and have hope and plan for your future and
Hmm.
decide to live again, right? But that
Yeah.
does not mean that the grief leaves us, goes bye bye, and never comes back again. And so being able to normalize that the same way joy is a natural part of life, so is grief. So
Yeah.
is grief. And so you have to find what works for you in your journey. I think, Arielle,
Hmm.
you said it, and I definitely have, since '03, I've had to find purpose, or like you said, meaning for my pain. So if
Right.
I felt that somebody could benefit from my story, or my deep empathy and awareness because of it, then
Hmm.
it doesn't feel like it was just this fruitless pain that I had to go through for no reason.
Yeah. I always tell people that life goes on whether you want it to or not.
Yep.
And we make the decision of what type of life that we're going to have. So
Yeah.
I realized that I've gone no matter if I wanted to or not. Of course, I
Yeah.
didn't want it to go on when I
Yeah.
lost Jordan,
Yeah.
but it goes on whether you want it to or not. So
Yeah.
I had to make a decision. Am I going to live life this way
Yeah.
miserably? Or am I going to do something different
Yeah.
and see what that's like? And
Yeah.
now I'm a big fan of living your best life.
Yeah.
So that's what I plan to do, and that's what I will continue to do. So
Absolutely.
see me on my social media living my best life, then go ahead and hit that heart button and keep it moving. Because yes, I'm a therapist, but I'm a human too. I like to have fun. So.
Client who came to me after her journey, we were saying that we believe that our infants are somewhere. Energy never dies, and so we believe that souls live forever. Once there's a heartbeat, there's something happening somewhere, in somewhere, right? I don't know
Mhm.
where. I don't need to know where, but
Mhm.
something's happening somewhere. And so, in that space, if energy never dies, that means while I'm here right now, what purposeful. And so, some quick tips that I want to leave with the audience as we close out, is just going to be a summarization of kind of what Arielle and I talked about. One, being able to assess what you need, confront your grief, welcome it if needed, normalize it, destigmatize it, because the truth is, grief can be like a pressure cooker. If you just avoid and distract, avoid is, if you have a pressure cooker and you don't let the steam up, it can explode, right?
Mhm.
And we can implode. And so, in that space, what I tell people is you'd rather have your grief be more of a slow cooker than a pressure cooker.
Right.
The thing with a slow cooker is nice and easy, but it's always kind of like you're aware of it, and you're aware that it'll ebb and flow and it'll come up in different ways. But every way that grief impacts you doesn't always come with the gut wrenching sadness either, right?
Mhm.
That doesn't mean it's not grief. And so be aware of where you are in your ever cycling grief cycle, right? Where you are and what you need. Access the resources that you have. And if you don't have enough resources, reach out. And
Mhm.
that can be just like Arielle said, if it's therapy, there's Psychology Today. Yes, they're pretty large, though. I would say there's also a lot of other directories that you could
Mhm.
get people. If you don't have insurance and money is a challenge, there's Open Path. If you are a person of color and or some, then you can go to inclusivetherapist.com. There's also therapy for Black girls. There's therapy for Black men. There is Therapy Den. There's so many different directories. Clinicians of Color also has a directory. There's so many
Mhm.
different directories that you can go to. And you can also go, if you do have insurance, you can go right to your health insurance. And these days, even have like how Arielle talked about EMDR, you can usually put in the modality that you're searching for and your
Mhm.
insurance that you have. And even on the insurance website, you can put in the modality that you're searching for. And if you want virtual, or if you want, yeah, if you want virtual, or if you would like it to be on, I don't know, in person, right? Whatever it is that you need, get it. If it's podcasts, if it's books, ask for resources. If it's a wellness retreat that you need, The biggest part is staying connected to you, your body, what you need. And if you're going through this with a mate or you have any loved ones around you, not cutting them out. As long as it's somebody that's supportive and that isn't emotionally pulling on you, being sure to lean into that can be really helpful. Moving your body and being aware of your body just through basic breathing exercises. If you can't get out of bed, you can do them right in bed. Whatever
Yep.
you need to do to keep moving, even if you're crawling. I had a friend the other day, one of my friends that I was talking about, tell me, I am literally crawling each day at a time. I'm crawling. That's literally
Hmm.
where I'm at. And I just thank God that she's crawling, that she just didn't stop altogether. And so, whatever you need to do, whoever you need to summon or tell or pull in, please do it. I'm excited and happy. Well, I'm excited for our guests to we don't record live. So I'm so excited for our guests to finally see this. But I'm so happy that we had a chance to have this real talk, like this real discussion that people can see, and hopefully gets the
Hmm.
conversations going and it keeps them going, because
Yeah.
yes, there's a month that we have this, but to your point, Arielle, I think we need to always be talking about it. We don't have to talk about it every day like each of us talk about it every day, but I think we
Mhm.
should always be spreading the word and always be opening up about our stories and our journeys and how we got to where we are, without any shame, without any feeling of being stigmatized at all, in our own timing, when the time is right for us to tell our stories. There's something so empowering. It gives the narrative. When you create your own narrative and you kind of tell your story, it gives you to control of it, the tone
Mhm.
of it, the delivery of it. And when things happen, when you experience things that feel like they happen to you and people are taken from you, you're looking for a sense of control. You're looking for something to empower you. And so, what I tell people is get empowered at doing the work to discover you, because this is part of your journey. It's not the entirety, even if in the moment it feels like it is. If you're still breathing, there's still work to do, whether it's work on ourselves, work with others, work to get our story out about our child that's no longer here. Whatever it is, I'm hoping and praying that each person listening has the strength to just put that one foot in front of the other, and or ask for help if they can't do that.
Right.
Okay? Be safe, guys, and we'll be back with our next episode. Take care.